Robert F. Kennedy and the Trump administration have talked quite a bit about the fact that there is a 400% increase in autism rates in children up to 8 years old between the year 2000 and 2022. They claim that in America, we've gone from 1 in 150 children having autism to 1 in 31 children having autism. This spike in autism rates has had its effect on millions of families across the country and has raised serious questions related to the food we eat, the vaccines we take, and the medicine we consume on a regular basis. And now, RFK Jr. announced that Tylenol, when taken late in pregnancy, is connected to the rise in autism rates. This announcement brought about a frenzy of reaction from both right-wing and left-wing media outlets, as well as social media outlets like TikTok, Instagram, and X. Much of the liberal mainstream media claimed that RFK Jr. was a quack conspiracy theorist who has no business lecturing the American people on health and medicine. And the liberals on TikTok thought it best to stick it to the Trump administration by downing as much Tylenol as humanly possible while pregnant. But aside from what the liberal regime is saying, I wanted to know more about this new study that the White House released and its legitimacy. I wanted to know if Tylenol causes autism, or is only associated with autism, or is not even associated at all with autism. So I reached out to Dr. Peter McCullough. You may know him from the days of COVID-19 in 2020. Dr. McCullough was one of the few doctors in America who challenged the mainstream narrative related to COVID vaccines and treatments. His career and his reputation were publicly condemned and ridiculed for this. To this day, Wikipedia says that, quote, McCullough has promoted misinformation and conspiracy theories about COVID-19, its treatments, and mRNA vaccines. Now that statement is an objective lie. Dr. McCullough was willing to put his life's work on the line during COVID and challenge the mainstream narrative, and he was right about everything he said. I thought it would be interesting to hear from Dr. McCullough about the new White House initiatives related to autism and their approach to learning about the autism epidemic. Are RFK Jr. and his team actually just liars and conspiracy theorists? Is the medical industry in the United States stuck in a downward spiral of ideological capture and a denial of facts and truth? And what's actually causing autism? Here's my interview with Dr. Peter McCullough. I hope you enjoy. All right, I am here with Dr. Peter McCullough. I'm excited for this conversation and this interview. There's been so much stuff that has happened since 2020 when I first heard about you and the whole COVID debacle and just what has happened in the medical industry over the past 5 years. And it feels like every week there's something new. And so within the last couple of weeks, we had the RFK and Trump administration announcing some stuff related to autism. I wanted to learn more about this. And so I thought, well, you'd probably be the best guy to have a conversation with. You know RFK, you have gotten famous over the last couple of years for speaking out and telling the truth in the medical industry. So let's just jump into this. And start with like the headlines. Okay. So RFK and the Trump administration has talked a lot about the fact that there's a 400% increase in autism rates for children up to 8 years old between the year 2000 and 2022. We went from 1 in 150 children having autism to now 1 in 31 children having autism. Now RFK announced new studies are showing that Tylenol, when used late in pregnancy, can cause long-term neurological effects in children. Let's just start with, is this true? What's your take on the study? And what was your reaction when you first heard this news?
Well, thanks for having me on the program. And, as introduced, I'm Dr. Peter McCullough. I'm in practice of both an internist and a cardiologist. I'm a research epidemiologist. And, I do see pregnant women as well as now autistic adults in my practice. And so I think the first point is the autism epidemic is real. The data are coming from the CDC Autism Spectrum Network, which is a 16-center network. They're carefully chronicling new cases of autism in children. Average child is diagnosed somewhere between the ages of 1 and 4. They're born normal, but then it's later on that the diagnosis is assured. But most actually have the diagnosis by age 4. It's currently one in 31 children with autism, 3.2% of the whole childhood population. And in some states like California, it's over 5%. Now, autism is a spectrum from just kind of quirky, very intelligent kids called Asperger's to profound autism. That means unable to communicate, repetitive head banging, screaming, wearing diapers, can't use the toilet, unassisted, very, very low IQ.
Wow.
And profound autism is 27% of the entire spectrum.
Wow.
Now that's huge. That means in California, more than 1% of kids are that way. They're going to rely on another 1 to 3% of the population to take care of them. So it's an existential crisis. And so it's been grossly under-researched. No large prospective cohort studies to investigate what's driving this. There have been no major long-term clinical trials of therapies, and parents have been scrambling.
Right.
So RFK is right. We're in an autism epidemic. It's a shame with these bloated budgets. Our CDC has a budget of over $9 billion. They've got 12,000 employees, and they're just watching this happen.
Right. I was just going to ask real quick, not to cut you off, sorry, but with 400% increase over 22 years, I feel like you would think to yourself just intuitively, hey, maybe we should take a look at this. Maybe we should. Well, why are they not? Why is it just till now that they've started to look into this? Do you know why?
You simply can't explain it. It's almost as if they don't want to know. Even in the peer-reviewed medical literature, there's very few papers questioning like what's behind this. There are more manuscripts simply advising on normalization. That is, we should accept neurodiversity. We shouldn't investigate what's behind this, but we should just accept it. That's typically the conclusion. Or we should get ready for more special needs. Now, recently, Trump came out with Robert F. Kennedy, FDA Commissioner Marty Makary, and NIH Director Jay Bhattacharya, as well as CMS Director Dr. Mehmet Oz, with the very first presidential news briefing on autism. It's the first time a president has actually mentioned the problem since LBJ, 1960s.
Yeah.
So that was big news right off the bat. And there's a lot of talking points from that news conference. Now, Trump pretty quickly got on the vaccines and said the childhood vaccines, there's too many of them. They're given all at once. They need to be spaced out. We need to get aluminum and mercury out of the vaccines. I think all true. There are now about 100 peer-reviewed papers pointing to giving lots of childhood vaccines altogether as being a risk factor for the development of autism.
Wow.
A risk factor. Many papers. And there's about 13 papers demonstrating the converse. That is, if a healthy child is born today and they take no vaccines, there's little or no chance of autism.
Really?
Because there's groups like the Amish and the Mennonites and others. They don't take vaccines, and there's essentially no autism.
That is, he mentioned that. Didn't Trump mention that in the speech?
Yeah. So right there, I think the big news from the conference is combination vaccines. We've got a problem on our hands, big problem. And, and I think it wouldn't be such a tense conversation if we didn't have school requirements or mandates. A lot of parents are starting to get really uncomfortable with this, right? 88 countries have no school requirements or mandates. You can take vaccines if you want to, but it's this part of it that makes people uncomfortable. Now, fortunately, 45 U.S. states have non-medical exemptions. So people, for religious or philosophical reasons like Texas, we don't have to take vaccines. And let me tell you what, people are filling out the exemption forms like you can't believe right now. People are pulling out of this. A recent paper published in JAMA shows that 60% of parents are not going to go through with this full vaccine schedule.
Wow. Wow. I
Okay.
had no idea that it was that
Yeah.
widespread because I live in Madison, Wisconsin. So everybody here thinks you're like a lunatic if you don't take all the vaccines and get like triple booster with the COVID vaccine. So,
Well, people can make their choices, but
right.
more and more people are being concerned about safety, not being
Absolutely.
cavalier with it.
Wow.
Now, the other announcement, this is largely by Robert F. Kennedy and Marty McCullough, was on a paper by Prada and colleagues. It was from Mount Sinai and Harvard, and simply a review
Yeah.
of older studies that linked potentially Tylenol administration during pregnancy. And so let me tell you that Prada paper is a real mixed review. So it's 46 studies. 27 studies found some linkage to what's called neuropsychiatric disorders. So that's far beyond autism. That's attention deficit disorder, autism spectrum, seizures, and tics. In that analysis, 9 studies showed no connection at all. 4 studies showed Tylenol actually helped prevent these problems. And then only 8 of them involved autism. And then of those, it was a 6-2 split there. Right. So Prada is very much a mixed decision. It's clearly far from being definitive. Tylenol already had a warning out in 2015 saying, listen, there may be something there for ADHD. We don't advise women take medicines during pregnancy at all. And then importantly, there's 3 large studies showing about 2/3 of women end up taking some Tylenol during pregnancy. The most common reason they take them is taking vaccines. So in the last 25 years, vaccines started to be given to pregnant women. Never done before. They just kind of, shaded their way into modern day obstetrics. And, women say, listen, they were told to take Tylenol because they're taking vaccines. And if they get a fever after vaccination, which is common, they can lose the baby. So that's a miscarriage in the first trimester, a stillbirth in the second trimester, or disastrously, a premature baby in the third trimester. And even the most recent vaccine added Abrivzio, which is the RSV vaccine. It has an official warning on it. So it says warning, may cause premature delivery.
Right.
So this whole Tylenol storyline, it looks like we're back to the vaccines. And none of these studies quantified, was it a single Tylenol capsule? Was it 250, 500, or 750? Was it taking Tylenol every day or just one time? Let me tell you, as a doctor, Tylenol is in and out of the body very quickly. There's no other context to which Tylenol has been linked to autism except with vaccination.
So that's interesting because I think, as I was looking into this and prepping for this interview, I was just kind of reading through the study and the big question I think is Tylenol the cause of autism or is it just associated with autism? It doesn't seem to me like it's the cause. I even went to some of the Hill said the guidance was given despite no causal evidence indicating a connection. Even WebMD had a whole paragraph related to this, highlighting the fact that the studies say that there is only an association and it's not the cause. So it's associated for sure. What do you do about the association? I mean, because basically,
I wouldn't even say associated for sure. I mean, it's kind of a mixed review. And again, the Prada paper is not conclusive. You can read it one of 2 ways. You could read the 4 studies that show Tylenol actually prevents autism. So, that's in the Prada review. So I think the American College of Obstetrics and Gynecology has it right. It's just, we don't need to create an undue alarm over Tylenol. Hopefully women won't take any medicines during pregnancy. Right. If they get a fever, they should treat it because if an untreated high fever, they're going to lose the baby. And they can't take ibuprofen and they can't take naproxen sodium or other nonsteroidals because then that actually can cause placental disruption and all kinds of problems.
Really?
So, we shouldn't put an undue warning about Tylenol during pregnancy. I mean, the best way for a woman not to take Tylenol during a pregnancy is to decline vaccination during pregnancy. So no vaccines, there won't be any need for Tylenol. Then we're back to natural pregnancy. When I came home that night, when it was on the news about Tylenol, my mom said, my wife said, what? And I asked her, she had our kids about 30 years ago. I said, did you take any vaccines during pregnancy? She goes, no. Did you take any Tylenol? No. Well, fine. My kids are fine. There's the answer right there.
Right. Well, okay. So do you think that this is just premature then? Or do you think that, why did Trump and RFK come out and say all of this if what you're saying is true? I mean, it just feels like it's causing hysteria among people. I mean, there's on TikTok, which is the worst place in the world, a bunch of liberal pregnant women like downing Tylenol to stick it to the Trump administration, which probably is not good for them at all. So why did they come out and say this? Or what was the plan, do you think?
It seemed like a very disjointed press conference. I have a lot of experience testifying in the Senate. I was just at the White House, a week ago. And I can tell you, if I was running the show, basically that whole group up on stage there, what was missing was a doctor with medical authority. That is a doctor who's a senior doctor, who reads the literature, understands what's going on, and to just give the bottom line. So if I was running that press conference, I'd say, listen, autism is a major problem, and looks like we have risk factors for autism. They include premature delivery before 37 weeks, older parents, this is all true, and then combination vaccines given very early in life. And we're going to investigate this now. And we want people to understand that the government is on it, and that we're going to be looking for treatments for autism. And I would have led with that. The story was not about Tylenol. You're right. It's just, it was, and the press conference seemed disjointed. It seemed like they were about ready to come out and just give that exact press conference that I just said. And at the last minute, they were giving some talking points about Tylenol, because you could tell that Trump was kind of confused. He got out there and he couldn't pronounce it. And he was like, what? Acetaminophen, Tylenol. And then he quickly got off that and he just went to the vaccines. And then on the questions and answers, Trump was back on the vaccines. He goes, yeah, the Amish don't get autism. And so it turns out Trump was actually, I think, holding true to the real talking points of the press conference. And there must have been some last minute shift in messaging, and the handlers told them, here, make it about Tylenol.
So you don't have to answer this if you don't want to, but why have you been contacted by the White House, or have they had any contact with you about being a part of what's happening because I'm not confused. I like RFK. I think he's like an honest and noble person, and I think he's done some really good stuff, but there's been questioning around his medical, I don't know, legitimacy throughout his whole campaign. And I don't have an opinion about it because I just haven't looked into it as much. But have they thought about bringing on somebody like you mentioned, somebody who's reading the literature, somebody who maybe is able to articulate some of this stuff in a more concise way that isn't going to cause hysteria? Because when I watched it, I was like, oh crap, my wife's pregnant right now. We got to stay away from Tylenol and everything, which we should anyways, but it just sort of makes you feel like, oh my goodness, did we take Tylenol last time? What about the last two kids that we've had? You start to get a little paranoid. Have you been contacted?
Yeah, multiple times. And my view is the Secretary of Health and Human Services traditionally has just been a bureaucrat, typically a lawyer. Like, we never even talked about Alex Azar or Xavier Becerra. Most people didn't even know who they were.
Right.
Do you know what I mean? So, a secretary of HHS should be a bureaucrat. HHS is bigger than the U.S. military in terms of budget. I mean, it's a big cabinet position. Now, RFK is unique because he's an activist. He does have, some medical knowledge, but he's not a doctor. He's never made life-saving decisions. He doesn't have, a law degree is 3 years. I mean, my training from the time I started, studying to the time I was fully baked was 17 years. I mean, it's not. And then on top of that, there are certain doctors who can make points on Fox News, and, I'm a frequent contributor on Fox. But then there's doctors who can actually do that and have medical authority. It's very different. So I have medical authority, meaning that I can make decisions, I publish my findings, and I change healthcare by doing that. Robert F. Kennedy can't do that. Marjorie Macary's never done that. Jay Bhattacharya, Oz, they don't have medical authority. It's a very different place. Medical authority means you make the call.
Right.
You make the call. And I'm telling you, I'm making the call. Tylenol is not a cause of autism. Someone's got to make the call. That is looking at the breadth and depth of this, because it's simply just now some confused messaging. You can see that the press conference didn't go off well, and everything is topsy and turvy. If we had doctors, with medical authority making the call in charge, the world would be a lot different. I mean, let me give you an example.
Yeah.
If we had a doctor who had medical authority in charge, we would have treated sick patients with COVID-19 at home, and we would have spared these hospitalizations and deaths. That's how big that would have been. Totally. We could have saved probably over 1 million lives if we had a doctor with medical authority in charge. Not Alex Azar, not Xavier Becerra, not Trump, not Biden, but a doctor with medical authority. The other thing we would have done is we would have pulled these vaccines off the market. The COVID shots would have been off the market by early January.
Yes.
Would have said, listen, I'm making the call. We're getting too many reports of deaths. Yes. This is getting out of control. They're off the market. Sorry. Yeah. They're off the market.
Right.
With autism, if we had a doctor who had medical authority, about 20 years ago, we'd say, wait a minute, we're seeing way, way too much autism. We need to start a large prospective registry. We need to get detailed information about these children, what's going on, where's the inflection point. The children are normal at birth. So it's not something that was taken during pregnancy. They're normal at birth. Then something happens around age 1 to 3. And the vignettes are that the child was perfectly fine. The parents know this. They took a huge bundle of vaccines. When a child takes the MMR vaccine in today's age, they take 5 additional ones at the same time. It's right off the bat. So that's 8 right there. Sometimes it can be as high as 16 at one setting. Let me tell you what, the clinical vignettes are, the vaccines caused an acute reaction with a high fever, lots of fussiness, crying, sometimes a seizure, and then the child quickly changes, and they're never the same again. And they develop autistic features. And this is best chronicled in a paper by Jonathan Poling. Poling is a former neurologist at Johns Hopkins. He actually wrote a case about his daughter, Hannah Poling, who for sure developed autism after taking a big bundle of vaccines. And the federal government agreed. His case was a test case in the omnibus proceedings in federal court in 2007, 2008. So a doctor who has medical authority would make these calls. We don't have that in Washington right now. We just have a lot of confusion, people trying to make talking points. And listen, I think it's fine to be a news contributor. I was on Fox News as much as anybody out there during the pandemic. And I was on ABC and Newsmax and all the other stations. It's great to have great communication skills, but there are very few doctors who have great communication skills and have medical authority. It's very different.
There's like a million questions that I have, but one is, well, the obvious question, why don't we have somebody with medical authority in those positions? Is it because the expertise that somebody like that would bring to the table would be intimidating, or do the administrations of the past 25 years just want yes men who kind of put the message out there and the narrative out there that they want? Like, what's the actual reasoning behind that? And then aside from that, well, let's just start with that. Do you know what the logic is behind that? Because if it just intuitively, if I was thinking, who am I going to put in charge of like the health of the country, I would think about, a doctor who was experienced, who had been in the industry and who had the medical degrees and who had the prestige within the industry to make those calls, like you're saying, And you're saying that that's not actually what they're doing. I don't even understand why you wouldn't do that. Do you know the logic here? I don't even.
The position of Secretary of Health and Human Services, typically a lawyer and a bureaucrat. So take that position off the table.
Yeah.
One could be influential as the director of the CDC. Okay. One could be influential as the director of the National Institutes of Health. Clearly, the FDA commissioner could be influential. I think very importantly, the Surgeon General can be influential. So all the positions are filled, except for right now, the Surgeon General.
Okay.
And in history, we've had C. Everett Koop as the Surgeon General, Bernadine Healy. We've had some big players that can make an impact, but it's all about selection. Yeah. It's all about selection. And as you know, I mean, many times who we end up with in Washington, there are many shortcomings.
Yeah.
And people ask that all the time. How many times have we had a president elected and everyone says, can't we do any better than that?
Yeah. Yeah, in my opinion, that's what happened during the Joe Biden era. It was like really?
Are there any more talented people in the entire country? And so what some have said is there's a very big difference between electability and competence.
I agree with that.
And so who gets elected are the most electable people, not necessarily the most competent. And then who gets appointed to positions may be, a product of who's confirmable, who isn't, who's going to follow marching orders. Remember, very authoritative doctors are typically not going to be good Indians. I mean, they're edge players. They're running the show. You know what I mean?
Yeah, totally. Yeah. I think the confusing thing about the vaccines, because it is true, like you think about how many vaccines they're pumping into kids just right when they're born. They come out of the womb and it's like just, putting whatever they can find into this kid. And you're like, what's going on? I mean, even we have 2 kids. My wife is 9 months pregnant. She could text me right now and say I'm going into labor and we'd have to leave. But it's overwhelming as a parent when your first kid comes. I'm not in the medical industry. I don't know all of the language and the lingo and all this stuff. And you're trying to like make sure they don't pump a bunch of weird chemicals into your kid, but you also just had your first kid. So you're kind of emotional and crying. The whole thing is like overwhelming, but it feels, again, very intuitive. I don't know the language. I don't know how to articulate it, but it feels intuitive to me that we shouldn't just pump babies with like 8 vaccines right away. That feels really weird. It's all of human history. We never did that.
Right.
And why is it, I don't want to get conspiratorial. I don't even have conspiracy theories about this, but as we're talking about it, I'm like, it feels like this is something very strange beneath the surface here, because just on an intuitive level, I just think most people would say, yeah, we probably shouldn't pump babies with chemicals.
It just seems too much. This summer I visited Tanzania in Africa.
Yeah.
And that's in the eastern part of Africa. And, the Maasai people are there, and you'll recognize them. They have these kind of red blankets they wear as shawls and cloaks and what have you. And they're very famed people. They're, fierce hunters. Well, they live in these compounds in what's considered these conservatory zones. But believe me, the lions and cheetahs can go right in there. I mean, and so they have 2 layers of fences around their compounds, and their huts are made of dung. They're actually made of manure from water buffalo and cows and what have you.
Wow. Okay.
And let me tell you what, they get pregnant there. They deliver their babies right there. There's no vitamin K shots. There's no hepatitis B. The point I'm making is it's a natural process. Now, there are some threats. If there's ever a threat of neonatal tetanus, it's actually in a Maasai hut. There's probably loads of tetanus spores there. But the point is, with modern day obstetrics, all you want is a clean delivery. That's all that's needed. It's a natural process. Make sure that the cord is clamped correctly, the placenta is delivered correctly, episiotomy, if it's needed, is handled, and then baby goes to mother. That's it. That's really all you need. Now, vitamin K is not compelling as a shot unless there's some coagulopathy, or maybe if the child is premature. hepatitis B for a mother who's hepatitis B negative and a normal baby. I mean, that's completely unnecessary. The
Isn't that
hepatitis
like
B
for if you're
that's only going to come later on if they become a paramedic or a nurse or a doctor. Like me, I took the hepatitis B shot, but you take it when it's appropriate.
isn't that related to, I don't know, like sexually?
Yeah.
Yeah, it's like if the husband's having an affair or something like that during
No, it's not even that. I mean, all
Really?
women are tested for hepatitis B. And, out of the 3.3 million babies born, maybe there's 4,000 women with hep B come from Asia or IV drug abusers. Sure, the baby should get the shot.
Yeah.
But the hepatitis B shot, and there's been studies on this, it doesn't even provide protection when they would need it later on. It's just given at the wrong time. I mean, some of these vaccines are just very poorly timed.
Yeah.
And
But that's weird because the medical industry in the United States is a multi-billion-dollar, multi-trillion-dollar industry. You would think that we would be able to know this stuff at this point. I mean, I just want to hear what you think about this. It does seem like, knowing the left-leaning tendency toward believing in the catastrophe of climate change and the aim of one of the aims, one of the goals in trying to fix climate change is to reduce the population, because that's part of the narrative. If we can reduce the population, then we don't use as much resources, then we don't leave a carbon footprint, blah, 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 blah. I don't even know if any of that is actually legitimate, but that's the talking points. Like, it feels like the vaccine would be a thing that would be an easy thing to kind of, I don't know, kill more people, more babies, or cause more problems.
I don't think so. I don't
Am
think
I
so.
going too far? I'm going okay.
Yeah, I think maybe you have gone too far. But no, I think it's just, there's this air of precaution that vaccination is good, that you get a baby, you can get everybody right there. So you have this capture. And then you have, you've got an industry. Well, listen, this is a lot of money. Half the vaccines in the United States are bought by the U.S. government. It's a $100 billion a year industry. Since 1986, it's been liability free. And then you have doctors who practice a religion. It is called vaccine ideology. It's in our book, Vaccines Ideology. It's a religion. And doctors religiously believe in vaccines. So do nurses. So they actually believe that they're doing good when they give this little baby these unnecessary shots. And we're at a point now where, in these vaccine trials, of all the childhood vaccines, they have what's called serious adverse events. Serious adverse events are death, hospitalization, prolongation of hospitalization, or disability or life-threatening. The severe adverse event rates with hepatitis B, diphtheria, pertussis, all these vaccines, they range between 3 and 9%. So it's not a low number.
Right.
So if a little baby gets a hepatitis B shot and has a seizure right there and aspirates, it's completely unnecessary. It's what we call iatrogenic. That means we caused it. And so if we've learned anything from this recent press conference, Trump, out of all the characters on stage, I think he was the most forthcoming. He said, listen, we're doing this to the kids. We're doing something to the kids. And so, in 2022, this got so far along, the World Council for Health, which is an evidence-based, consensus-driven, physician-led organization. It's like the WHO. It's another body out there. They said, listen, for childhood vaccines, if the child is normal at birth, and you'll know it right away, then it's safer to wait on all these vaccines. Wait on all of them. And that World Council for Health, I mean, that's a good place to go for a recommendation. And it's just safer to wait. You get beyond 4 years, or certainly beyond 9 years, these vaccines become much lower risk. And then vaccines should be given one by one, not in combinations. The combinations, the MMR was the first combination, measles, mumps, and rubella. That actually developed such a bad track record. The Japanese don't even allow that in Japan. And they're every bit as sophisticated as us, even more. They said, listen, take them individually. You just don't take them as a bundle.
So the hard thing is that there's such, like you're saying, there's such a religious attitude around this in the hospitals. And when you go and your wife gives birth and they're saying you need this one, and this one, sign here, here, and here, and they start doing this. And the thing about it is, like, when you start to say some of these things that you're saying right now, they'll look at you kind of like you're insane. And you said Trump said that we're doing this to these kids. At what point is it like this is a crime or something? Like, if we're purposefully inflicting harm on children, well, and we have the data, it looks like we know that there's a problem with what we're doing, mm-hmm. and the entire industry is saying they're pressuring parents and people into doing this. At what point does this turn into a crime?
I think it needs thorough investigation. A recent paper in JAMA shows 60% of the parents are backing off on the vaccine schedule. So this is quickly unraveling, by the way. Mm-hmm. I think you're going to find the answer pretty quickly. Mm-hmm. And I speak at large events. I talk to a lot of mothers, and every mother of a child who took no vaccines whatsoever, the kid is healthy as a horse. Mm-hmm. And we're not seeing recurrent pertussis or diphtheria, or polio is not back after 20 years, or mm-hmm. They're fine. These mm-hmm. diseases are not lurking in our schools and our homes, and yet papers are being published. There was one recently in JAMA, another one in Annals of Internal Medicine, says that if we let up on these vaccines even a little bit, these diseases are going to come roaring back.
Yeah, that's what I heard.
Anderson Cooper and Sanjay Gupta, who's my colleague over at CNN. Sanjay Gupta, they got out pictures of the iron lung machine for polio. It's like, iron lung machine. Give me a break. I mean, even if a child developed a problem, like let's say a kid takes a flu shot and they get Guillain-Barré syndrome. Now that's a real paralysis that can happen. We don't use an iron lung machine. We use a mechanical ventilator, and hopefully get them better through plasma exchange and other things. So we have treatment now. But a lot of people don't realize, the number of kids with profound autism today, I mean, completely disabled the rest of their life, is way bigger than polio. Way bigger than polio. And I've got some patients in my practice with polio. And yeah, they may have, a lower limb or something that doesn't work as well, and they have to wear a brace, but they're mentally intact. These kids with profound autism, I have them in my practice. Some of them are screaming 24/7. Can you imagine as a parent for the rest of your life, you just have this, just completely difficult to manage, screaming, unmanageable child who can't toilet themselves, can't shower themselves. That's a million times worse than polio.
Right. Because you were told that you needed to get this vaccine that it turns out you really didn't need to get. And but my question then is what would be your advice then for are you just don't get any of the vaccines at all? Or are there any of them that you think, okay, yeah, get this one, because this was something my wife and I have been talking about because we have a baby on the way. Like and there's so many opinions right now from everybody. You got some people, even in your own family, who get all of them and we're not doing that. And then there's like others who are like, don't get any of them. So is there any happy medium? Is there anywhere in the middle, or is it really all or nothing here? Like,
I would do risk stratification. So let's take, hopefully for you, a healthy baby. So if the baby's perfectly healthy at birth, so the baby's delivered, the cord is clamped, the placenta is delivered, Apgar scores are perfect, baby goes to mother, and that's it. Nothing else. Yes. No vitamin K shots, no hepatitis B shots, just a normal delivery. Okay. And in a normal child, I would follow the World Council for Health, safer to wait. And just say, listen, we're going to decline all the vaccines in the hospital. And we'll go to a pediatric office that, allows free choice. And we'll just watch how the child develops. If the child has no problems, they don't develop any lung problems or no known heart problems, no seizures, nothing else, to just forego the vaccines. You can and then later on, make some decisions. So let's give an example. As a girl enters the reproductive years, the rubella vaccine could be more compelling because, congenital rubella syndrome is a real syndrome. Now, it largely doesn't happen anymore, but if there was a concern, you could take a rubella vaccine. Now, unfortunately, I don't think there's any more single rubella vaccines. It would have to be an MMR shot, but far safer when you take it, at an older period of time. Let's say someone is at risk for sexual contact, ill-advised, tattoos, paramedic, nurse, doctor. I'd get the hepatitis B vaccine. Personally, I would do that. I would kind of leave it there. So that would probably be 2 shots. Now let's do a different scenario.
Yeah.
Let's say the child is born, immediately has pulmonary problems, and sadly, you're told your child has cystic fibrosis. They've got a chronic lung condition. Different story. Different story. Right. So again, I would skip vitamin K and hepatitis B, but I would accept the RSV vaccine in the child when available. There's a monoclonal antibody called nirsevimab. I would accept that. I'd accept diphtheria, tetanus, pertussis. I'd accept influenza, pneumococcal, Haemophilus influenza B, measles, mumps, rubella. They all can cause pulmonary syndrome. I think in that case, it would be a tragedy to have a child with cystic fibrosis and have him die of measles pneumonia, for instance.
Right.
It'd just be a tragedy. So that would be an example where you would kind of, follow a more full schedule, cystic fibrosis. Let me give you another one.
Yeah.
The child's lungs are fine and heart is fine, but they end up born without a spleen. They have a congenital asplenia.
Wow.
Or they have a bone marrow problem. Boy, the ones that make sense are pneumococcus, Haemophilus influenza, and meningococcal vaccines. Later on in life, they play a big role. The viral ones don't make a big deal. And then here's another issue: the child is born prematurely. The child's born prematurely at 32 weeks. Well, I would take the vitamin K shot for sure, because there can be a risk of intracranial hemorrhage there. And a premature baby, no vaccines in the hospital because they can cause apnea. But as the child is born and develops, they may be at risk for sinopulmonary problems and probably follow more of a full schedule there, but later on in life. And so each one you can kind of, make decisions. How about this? How about a family history of autism and a sibling with autism? Well, there, I don't think I'd accept any vaccines. I think it'd just be too risky, and put them farther off in life. But as a general rule, fewer vaccines, lower risk. Vaccines given separately, lower risk, and vaccines given later in life, way lower risk. So here's a working example: the measles, mumps, rubella vaccine recently has added varicella, so it's MMRV.
Yeah.
Well, the Advisory Committee on Immunization Practices just changed this. They said, listen, you can't give this at age 1. There's too many seizures. I mean, the kids are having seizures with these shots, for crying out loud. You have to wait until after age 4. That's a very reasonable solution. But let me tell you, as a parent, you don't want to take your child into the pediatrician's office and have seizures.
No.
So the best way to avoid that is say, listen, our child is healthy. We're going to pass on these. Looking at you, Andy, you could almost pass as an Amish man. You could say, I'm Amish. I'm going to pass.
Like I don't even know how to use technology. We're just not going to do this. We haven't used a light switch my entire life. No, that's actually all really helpful. But I do think that that even as you're talking about it, it brings to light the fact that the medical industry seems incredibly corrupt because you've got all this information and you know this, you've been doing this your whole life. And there are doctors like you who know this stuff, but the average American, it's really hard in those conversations with nurses and doctors when they're pushing it. They're the authority. And like, I don't know the details to all of it. And maybe not every hospital system is exactly like this. And maybe it's just where I'm at in Madison, but it does seem to point to the fact that it doesn't feel like the medical industry, again, I'm painting with a broad stroke here, but is interested in sort of tailoring your health to your body, your family, your history. It's sort of like, you got to get this vaccine because that's what we tell everybody to get. One size fits all. And it's really hard to argue with that if you're, like a carpenter or something like that, or somebody who's just not even near the medical industry. You don't know any of this stuff. And the other thing that I was thinking was, you should just write a book giving like a bunch of different scenarios and saying, hey, if your child is born like this or this, do this, don't do this, wait, this. That would be really helpful. Anyway, that was just one thing.
Let me give you a couple of guides. So online, Children's Health Defense does have a parent's guide to vaccination. So if you go to Children's Health Defense, it's about 70 pages.
Okay.
If you want to pick up a book, a really good one, the first author is Barkey, Barke. First, Jeff Barkey. He's a family doctor. He goes through every vaccine.
Okay.
Risks and benefits. It's very thorough. Mm-hmm. And you can come up with a solution. Now, let me tell you, when I was born, there were just 5 diseases vaccinated for. So there was polio, smallpox, diphtheria, tetanus, pertussis. That's it. 5. That's all I had. Mm-hmm. And then later on, I took a measles shot when that became available. And then it went on from there. But a child born, so maybe under age 1, like 5 shots maybe. Now a child under age 1, they actually get 29 shots. Wow. And that's before the first year of life. It's many have concluded it's simply too much. And the scary thing is the vaccine industry, the World Health Organization has Agenda 2020. They want 500 vaccines. 500.
When are you going to do that? When through
the lifetime that you would get 500 vaccines. And Paul Offit, who's a vaccine promoter, he used to be on all these panels. You'll see him on CNN and ABC. He's actually written this. He wants to see 1,000. He thinks these kids can take it. It's just, my common sense tells me it's just not safe. If I gave you 16 drugs at once, which is common at age 1, I'm just telling you now, you'd have a side effect. You can't give a little baby all these things at once and not have a side effect. So I think the practice of combination vaccination is going to go. The Japanese had it right. And we're going to go fewer vaccines. And you know what? People make a big deal out of a couple thousand measles cases in the United States per year. Do you know worldwide some years there's 600,000 cases of measles? I mean, measles is a skin rash. And if kids get sick, they can get some steroids or secondary antibiotics, nebulizers, and they can get through it. No child should die of measles in the United States with modern treatment. Now, sadly, there's been a couple measles deaths this year, and they've been investigated. Is because the kids were denied treatment. They were Mennonites, and they got denied treatment. They didn't get the antibiotics and steroids as they should. So that got investigated. The media dropped that right away. As soon as that got investigated, the media said, we're not going to make such a big deal out of these measles, quote, measles deaths. And so, and the other thing the CDC is not doing, and I think it's very disingenuous, on these measles outbreaks, if you read the CDC measles update, it'll say that 95% of these measles cases are unvaccinated or vaccine status unknown. Well, what does that mean? You got CDC officers, you got 12,000 employees. They can't find the vaccine records and work with the family members. Right. That's a bunch of bull. So these are people who took vaccines. Maybe they can't find their vaccine card or vaccine records. And they probably tell the CDC, my kid took the vaccines. But they're saying, well, you can't verify it. So we're going to make it unknown. So, so listen, even if you take all these vaccines, you still can get the disease. I mean, even in the Salk polio field trials, 1.8 million kids were tested. The polio vaccine was only about 60 to 70% protective. So it's not perfect. Polio vaccine didn't prevent 100% of polio cases. There's no way. And the same thing with measles cases. Recently I went on a show, Dr. Ben Edwards. Ben went to Baylor with me just a few years after me. He's taking care of more measles cases now probably than anybody in the country. So Ben's out in West Texas. He's taking care of the Mennonites who are not taking vaccines, and they get measles. So Ben's taken as many measles shots as me. I think I've had 4 of them. And guess what? Ben gets measles.
Really?
Yeah.
Okay.
I
feel like during COVID, that's what we heard. Like we heard, or we should have learned that during COVID was the Biden and Fauci came out. You get the vaccine, you'll never get COVID, and then everybody got the vaccine and everybody got COVID. And we should have learned that, which we should have known that beforehand. But there is this sort of idealized, I don't know what it is in America, where there's this idea that like, if I get this vaccine, I should not ever get sick. It's
a wild claim, and it comes from this religion of vaccines. It came out very early, where someone said, "Listen, take this shot, and you're good. You're good." And we're like, "Wait a minute, how do you know? I mean, I'm going to live 50 years or 80 years. How do you know a shot when I take when I'm 1 year old is going to be good forever?" So it's mankind trying to mimic natural immunity. Now, it turns out natural immunity is good. If you get measles as a kid, you are good. You're not going to get measles again.
Right.
Guess what? As a kid, I had chickenpox. I'm not going to get chickenpox again. Right. So natural immunity is what gives that enduring result, not vaccines. Vaccines are trying to approximate that, but vaccines are never as good as natural immunity.
They were even trying to, if I remember this correctly, during COVID, go after natural immunity as well. Even if you had COVID and had made it through, they still, I think, recommended to get the vaccines and everything. Am I wrong about that?
They did. In fact, it was worse. There was press conferences where Fauci and others, they said the vaccine is superior to natural immunity. Now, that's never happened in the history of medicine or mankind. Why would we believe that now? I mean, so that's an example of hubris. That's
a vaccine made in the shortest period of time.
Yeah, and a brand new genetic vaccine coding for a lethal part of the virus, the spike protein, and it's better than natural immunity. You think about the hubris and the arrogance of making that claim. So, as COVID turned out, I had it during 2020. I was very fortunate. So I had natural immunity. So, every other illness later on was going to be mild. I already had it. I was good. So there was no rationale for me to take a vaccine. And yet I was told that I was at a big hospital at that time. I was a professor of medicine. I said, "Well, you should take a vaccine." I said, "Well, I've already had it. I've already had it." In fact, at that time, there were 3 studies. The first author is Raw, Cameron, Methodius, 3 studies showing that if you already had COVID illness and you take a vaccine, you're going to get a ton of side effects. In fact, you may be hospitalized from the vaccine. So it was known early. It was dangerous to take a shot after you already had COVID.
No, I remember my wife and I just last night were just talking about, because I'm 26. So this all happened when I was 20 years old and 19, 20 years old when COVID started. So we were just talking about how weird that whole time was and how it was hard to figure out what was real and what wasn't. And I think this does come down to, though, there's a serious question of the integrity of the medical industry in the United States. A lot of people don't trust their doctors. They don't trust the institutions anymore. And for good reason. I think 2020 pretty much exposed that the large institutions and the authorities within those institutions were willing to even objectively lie about things for some reason. And a lot of the people just in regular doctors and nurses who kind of knew that what they were doing maybe wasn't that good just kind of didn't speak up. They just kind of kept their mouth shut. A lot of them did speak up, and those people are heroes, and we should be thankful for them. But there were so many people who just didn't say anything. How do you fix? I don't know if this is $1 million question. How do you fix the medical industry in the United States and bring back trust in the institution, because people just don't trust them anymore?
Well, we need them. Let me tell you this much. Robert F. Kennedy and the health freedom movement, they can't do it alone. Let me tell you, healthcare is big in the United States. We got 1 million doctors, 500,000 nurse practitioners and PAs. We got about 7 million nurses, 5,600 hospitals, 2,200 acute care hospitals. Believe me, Robert F. Kennedy is not going to do it. It wouldn't matter who's in there.
Mm-hmm.
So we have to get the medical community back. And the thing that I think worries me most is the COVID vaccine safety debacle, where the COVID vaccines for sure cause fatal heart damage, for sure blood clots, heart damage, stroke, autoimmune problems, and they may even be related to cancer. I mean, there's thousands of papers pouring in. My office is a war zone of problems. Do you know not a single doctor at a major medical center, let's say major Mayo Clinic, Harvard, not a single doctor, not one, has stepped out and said, I'm concerned about this.
Yeah.
I'm concerned about the heart damage I'm seeing, or the cardiac arrests, or the blood
you're called crazy if you say anything.
Yeah, not a single one. And let me tell you, blood clots. I see blood clots going from the ankle to the hip. I never saw that before the pandemic.
What even?
What
is that?
The spike protein from the vaccine. Now, the virus looks like this.
Mm-hmm.
The virus looks like this.
Yes.
And then the spike protein is a little tip on the surface. Well, the vaccine manufactures a ton of this spike protein, massive amounts. It gets stuck in the body and it causes blood clots.
Okay, that makes sense.
The spike protein physically causes blood clots.
Yeah.
The spike protein from the vaccine is found in the brain of bursted blood vessels. It's found in the heart, causing heart damage. It's due to the spike protein. It's clear. You can't give a vaccine, it's a genetic vaccine, and produce uncontrolled amounts of spike protein in the body for months or years without getting complications. It's a really bad idea. So Pfizer and Moderna were terrible ideas.
But did they know this? Did they know all of this in 2020?
Listen, I published an op-ed in August of 2020 in The Hill. That's for the House, Senate, and the White House. I said, listen, this is a gamble. This is the worst idea ever. It's a terrible idea. Now, Janssen and AstraZeneca, which was just a big burst of spike protein production from an adenoviral vector, those things were pulled off the market. They just pulled those things.
Yeah.
And Novavax, which is probably the safest vaccine, is just given a limited amount of the spike protein. It can't multiply in you, but it's a limit. It's 5 micrograms of spike. So someone contacted me today, said, Dr. McCullough, I have to take a vaccine for my medical career. Which one do I take? I said, listen, if I had a gun to my head, I'd take Novavax. Far and away the safest of the COVID vaccines. But isn't it curious that no one ever mentions Novavax? The CDC never mentions it, the FDA. All you hear is about Pfizer and Moderna.
So, this leads into, and I know we don't have a ton of time, but Trump RX, the new, I don't even know what it is. He just announced Trump RX. They're going to sell pharmaceuticals through the federal government. I don't exactly know how it's going to work. I'm conservative. I generally am skeptical of federal government doing anything. They usually don't do a good job at things. But he's standing up there in this press conference or whatever with the CEO of Pfizer, right? And this is one of the weird things about Trump and the right, the political right now, is Trump has been counter a lot of the institutions, a lot of the big kind of controlling groups in the country. And he's been sort of this, I don't know, just a very countercultural person. And he's been able to take a lot of those, big conservative, big Republican groups. But it feels like with big pharmaceutical, he is just like all in on Pfizer and everything. And I'm just confused. Like, why is he standing up there with the CEO of Pfizer after everything that happened over the last 5 years? It feels like that's sort of a slap in the face to a lot of his voters who I think don't appreciate what Pfizer did. What did you think about that?
I concur. Pfizer knew about 1,223 Pfizer deaths due to the vaccine just within 90 days of their shot, and they didn't come forward and warn anybody.
That's like a CDC? I don't know what it's called. Isn't it like some sort of, you have to blacklist? There should be FDA should have a black box warning. Yes. Pfizer should have pulled their product off the market. But it looks like Trump really got played by Pfizer. Here's the backstory here. Pfizer's big horse right now, their pharmaceutical
horse that's earning them money, tons, billions, is a drug called Eliquis.
Yes.
Eliquis. It's for blood clots. Well, why are we using so much Eliquis? Because there's so many vaccine blood clots.
Yeah.
Well, listen to this. The competitor to Eliquis is Xarelto. Xarelto just went full generic this month. And so Eliquis goes for $600 a month. And now the competitor, Mark Cuban just put this out there, and GoodRx has the competitor for $60 a month. So listen, Albert Bourla was going to lower his costs anyway. He had to, because Eliquis is going to get gutted. Now he just got a $70 billion actually injection into Pfizer. This is unbelievable. It's unbelievable how the government gets played on these simple things.
And is this, again, because of what you were saying at the beginning, that there is a lack of authoritative voice in those, I guess, in those meetings, whatever those meetings are happening behind closed doors in which they're agreeing to partner with Pfizer and things like that? You know, if somebody like you were in there, do you think that the story would be different? Do you think that they would have?
Well, yeah. I mean, if I was in there, Pfizer wouldn't get anywhere because of their vaccine deaths. I'd say, listen, your product's got to come off the market. Now let's talk about future products. Well, what are you going to do with Eliquis pricing since you're just going to get gutted by generics? No, we're not going to support Pfizer just so they can try to support Eliquis for 2 more years.
Right.
It's just, the whole thing is just, there was corruption when we started, and there's corruption when we're finishing here, right? Yeah. We're back to the same corrupt practices.
And there's a lot of money involved in it too, which I think, when I was on the Scott Jensen campaign, he would always just say, follow the money, figure out where the money is. And that takes you to places you probably don't want to go, but that we need to go because we need to figure out what's going on. I'll ask this final question because I think it's just interesting. Like I was part of the Scott Jensen campaign in Minnesota, and he kind of got famous, during COVID for questioning the legitimacy of the death certificates, in which they were kind of saying, if you get into a car accident and you had COVID in your system, just put COVID as the primary cause of death, not the secondary cause of death. And I've always wondered, and I don't think we'll ever be able to know, how many people actually died from COVID, because though that just totally skews and screws up the statistics. And I don't know how we could ever figure it out, but how many people do you actually think died from COVID? Best guess, I guess.
Well, the official number is 1.2 million Americans, roundabout. Now, this should tell you something. The National Center for Health Statistics stopped doing the analyses in mid-2023. So from their perspective, COVID was over with in mid-2023. But in the data tables they produced in mid-2023, half of cases, there was no pneumonia on the chart at all. None. Zero. So without any pneumonia, it's extremely unlikely they died of COVID. And I think if we were to carefully adjudicate them, there's other papers suggesting they died of influenza, they died of pneumococcal or Klebsiella pneumonia, that if we were to properly adjudicate it, we'd probably get down to 10%. So I think it's 10% of 1.2 million. I'd stand behind 120,000 Americans died of COVID. Unnecessarily so. I think the vast majority could have been saved by McCullough protocol. That became the Association of American Physicians and Surgeons protocol. I published it in the American Journal of Medicine. I did the best I could. Yeah. It's sad people didn't receive the protocol. They didn't even receive the monoclonal antibodies and the other drugs that could make a difference. So when we go back here, we've peeled back part of the onion here. It doesn't look good. I wish the steps that were being taken now, are better, but it looks like they're not. There's misdirection, there's misrepresentation, and it looks like there's continued corruption.
Now, if it's just slightly over 100,000 people dead, is that even a pandemic anymore? Or what constitutes
it's a pandemic because we all got sick, but a bad flu year would be 70,000 flu-associated deaths.
Right.
It's maybe a little bit worse than a bad flu season, but again, it should have been. I think that could have been narrowed to 30 to 50,000 deaths. It really could have.
Wow.
It was sad. By the way, virtually all the deaths occurred in the hospital. That told you something. People weren't dying at home. Do you know there's homeless people who ate out of dumpsters? You didn't hear about them dying of COVID out in city parks.
No. No, and I did hear too that the CDC's own protocol is to not shut everything down during something like this, because staying inside cooped up could pass along the virus quicker.
Mhm.
And just thinking back to the fact that we all just sat in our houses, like I looked outside the window every once in a while and it was a ghost town. Nobody was out in the streets, and it would have been better. I mean, it would have been better for people to just be outside
Oh,
and
yeah.
to go for walks and to go to work.
Yeah, the first version of McCullough Protocol, this is published in August of 2020, to tell you where we were.
Yeah.
The first step is open the windows, get outside and get fresh air.
Right.
And there were papers from Singapore showing you can't get it outside.
Yeah.
People were worried about going to football stadiums. They shut down. It was all just an overreaction. And it was wrong because it was so different. So you guys were probably locked down up there in Madison. Down here in Texas, we were outside jogging, eating at restaurants. Listen, we're the same country. It's the same disease. My colleagues in France, it was so bad in Paris, you had to get an affidavit, a government affidavit, to go to the grocery store.
Yeah. Yeah. People were going to prison in Australia, right? For being outside. You go on a walk and you have to go to prison. It's like, the whole thing is crazy. I think it's going to be a long, long time until we figure out exactly what happened, if we ever actually do, because there's so much corruption over the time. But anyways, like, thanks for doing this. Thanks for talking, because I think a lot of people just hearing the news about Tylenol and autism, and a lot of people wanting to know, how can we stop this problem? All these kids have autism now. It's a horrible thing. It's encouraging that the administration is willing to think about it and look at it, but it's also discouraging, to hear what you said, which is they probably should have, their messaging should have been a little bit better, because this is probably going to cause a little bit of paranoia among people. But thanks for your expertise and for taking time to talk. I really appreciate it.
Okay. Thank you.